Psoriasis. What is that?
A genetic predisposition, an inherited tendency toward a metabolic disorder that causes the skin to behave abnormally. So there is an irritation in the skin, the blood vessels open up, the inflammation goes in and changes the dynamics of the skin. That instead of taking 28 days to get through its normal cycle, it suddenly goes haywire and makes it in 3 days. Okay. So the approach has been poison, 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 poison.
When you use poison, like what is poison?
I mean poison. And I mean, it's the old approach was sunlamp treatments because it had an anti-inflammatory effect. That really is the safest thing. Once you get away from that, you use topical cortisone, strong, which worked only temporarily by constricting the blood vessel.
Right.
But it thins the skin, so you can't keep using it. Vitamin D topically was okay, was no great shakes. Then they used the topical vitamin A, which is temporarily suppressive. So then the approach became internal drugs, methotrexate, cancer drug, cyclosporine, immunosuppressive drug that raises your blood pressure, you can't stay on it more than a year. Next drug is Soratane, which you can't use in any woman under the age of 50 because it'll cause birth defects. And there's no safe wash out there.
What would be your approach?
Depends how expensive it is. If it's localized, lights are still good. They're safe, they're not a big deal. If it's localized, the laser is a strong light. The same laser that works on vitiligo works on psoriasis.
Now sometimes kids have a mild case and it seems to get better. What would you do in a mild case?
I'd look for strep.
But we're talking like a 2-month-old.
I'd look for strep.
Strep could be a trigger?
Yeah. Guy down in Tennessee years ago showed that strep was a trigger. I firmly believe there are a lot of people who are walking around who are strep carriers.
So strep carriers, in your opinion,
Can trigger psoriasis.
It's not a benign. We should say it's just living there inside.
There's a condition called guttate psoriasis, where they get little patches of psoriasis. It comes out after a strep infection. Okay. If you try and treat that, you can't get rid of it.
Does that Vitone or Viaform stuff work at all?
No. However, if you give them a very tiny dose of antibiotics in a suppressive dose for about 3 months, and I'm talking about really tiny dose, like tetracycline 250 every other day.
Well, we can't give a baby that.
I'm talking about like a 16-year-old. But
We're talking a baby now.
A baby, then just treat it topically if it's localized.
Which would be with?
Topical steroid and vitamin D. But prescription D.
And the older kids, like 15-year-old, you could talk about this.
I would look for underlying strep. The other thing is there are people in the alternative space who feel it's a food allergy. That's the trigger.
And if it gets really bad, the ultimate treatment is what?
I would look for the strep and I would look for food. I would look for easy things first, although not a lot of people get those things. And then there are now biologic drugs where you give yourself shots every week, and a small subset of people are going to need that. Not so much in the adolescent age group, but if you get a really, really bad kid, they're going for biologics.
And they do work.
Yeah, but not forever. They work only while you're using them. So now you committed a kid to to immunosuppressive drugs for years.
You have to have great concern about a situation like that.
Yeah, I mean, like, in other words, the pharmaceutical companies think they're candy. However, there's a statistical chance you're increasing someone's chance of getting cancer.
Any particular type of cancer?
Lymphoma.
Lymphoma.
And you have to make sure they don't have TB, because it's going to make the TB go crazy.
So the rule is you have to be very careful, very selective.
Biologics in adults are being used like candy right now.
You should be careful.
They're very, very expensive, so like I believe that there's X number of healthcare dollars, and when every person costs $20,000 a year for their pharmaceutical agents, the system can't survive.
Okay, thank you very much.